Hi everyone, I'm Jen, and today I'm going to be talking you through a demo of our torso that we have here. And this is one piece of equipment that we have in our IPEM Outreach Library. So what we're going to do is take a look at some pre-printed scans. I'll talk you through what the scans are and what kind of anatomy it is. And this is all to demonstrate how we see inside the body using various medical physics techniques. So this is the first one. And this is a CT scan of the lungs, which are here. And you can see from the lungs, from the texture, that it's very light, which you would expect. Obviously, lungs are always filled with air. And the reason why I know that this is a CT scan of the lungs is because the lungs are showing up black. And that means that there isn't as much density in there for the radiation to sort of bounce off of and create an image. So that's why it shows up dark. So quite often we use CT scans to take images of parts of the body where there's quite a variation in the levels of density between different tissues. So for example, here with the lungs, we have the lung, which is right next to the heart, and then also next to the rib cage. So we have a lot of high density tissue, which is bone, next to the lungs, which is mainly air, and then next to the heart, which is sort of fatty kind of tissue. So that's why CT scans are really useful for looking at things like lungs. The next one I have is a nuclear medicine scan. And this is a nuclear medicine scan of a human brain. So we have a prop here, which is part of the brain from this torso. And this scan basically shows all the different activity that's going on inside the brain. So this is based on sort of the metabolic rate of certain nutrients entering the brain, and then we measure that to create a sort of map of activity of the brain. And that really helps us to see which parts of the brain are maybe functioning better than others, and it can help us diagnose certain medical conditions as well. The next scan that I have is an ultrasound scan, and this is a doppler ultrasound. So as you can see here, there's sort of a grey conical shape, and then inside we have sort of a bit of a colour map. And this is actually showing the function of blood flow inside a vein or an artery. So we can see how the blood is flowing. So the blue areas are areas of anti-flow, and the red areas are areas of forward flow. And what this scan does, it doesn't give us much information about the anatomy because it just gives us sort of a bit of a grey picture. And for this particular technique, that's absolutely fine because all we want to see is how that blood is flowing. Obviously, we use ultrasound for lots of other things as well, most commonly in things like pregnancy, where actually the image is much more important. But in this case, for a Doppler ultrasound, we're not as bothered about the image, it's more about the function. And this could be sort of anywhere on the body where there are significant veins and arteries. And this would go potentially sort of in the neck area, could also go in the legs, and maybe sort of close to the heart as well. And the final scan that I have is an MRI scan of the bowel. So if we take a look at the torso here, we've obviously got the heart here, which we can remove. We have the diaphragm, we have the liver, the stomach, and then we have the bowel here. So we can see really nicely here that this is the large bowel and then the small bowel, and we can see that reflected in the MRI scan here. And I can tell that this is an MRI scan because areas that show up bright on an MRI scan are areas that have a really high concentration of water. So you can imagine, you're drinking lots of fluid, you're eating lots of things, a lot of that water then is in your digestive system, which is why then it's a high water concentration. And then we can see sort of on the edges, it's a bit darker, and that's because it's more muscle, which has less water concentration than the bowel does. So that's just a subset of all the different types of imaging that we do within medical physics. They have lots of different techniques and lots of different areas of the body that they focus on. And this is just a short snippet of this demonstration.